USMLE Step 1 Anatomy. What you need to know. Imagine trying to solve a puzzle where every piece is a part of the human body. That's what anatomy questions on the USMLE Step 1 are like. They test your understanding of how the body is built and how it works. Anatomy is a core part of the exam because knowing the structure helps you understand disease and treatment. The questions cover many areas, including gross anatomy, neuroanatomy, and embryology. You need to know the structure and blood supply of organs and systems. For example, understanding the blood flow to the brain or the nerves in the arm can help you answer clinical questions. You should also be familiar with anatomical landmarks and variations that can affect surgery or diagnosis. The exam often shows images like diagrams, radiographs, or histology slides. You might be asked to identify a nerve, a blood vessel, or a muscle from a picture. Sometimes, questions describe symptoms caused by nerve injuries or vascular problems. For example, a question might describe weakness in shoulder abduction and ask which nerve is affected. It's important to connect anatomy with clinical scenarios. This means knowing how an injury or disease impacts body parts and functions. Embryology is another key area. You need to understand how organs develop and what happens when development goes wrong. Congenital anomalies like cleft palate or heart defects are common topics. Knowing the normal stages of development helps you recognize these issues. Focus on high-yield topics that appear often on the exam. These include the brachial plexus, cranial nerves, the heart and its vessels, and the central nervous system. Use study resources that combine anatomy with pathology and physiology. This integrated approach makes it easier to remember and apply what you learn. Practical knowledge of anatomy is vital for understanding physical exam findings and procedures. For example, knowing the course of the recurrent laryngeal nerve explains why vocal cord paralysis can happen after thyroid surgery. It also helps you anticipate complications during procedures. Preparation should include active recall, practicing with images, and applying your knowledge to clinical vignettes. Remember, anatomy on the USMLE Step 1 is not just about memorizing structures but understanding how they relate to health and disease. Mastering gross anatomy, neuroanatomy, and embryology with a focus on clinical connections will prepare you to answer questions confidently. Keep practicing these concepts in context, and you'll be ready to tackle the anatomy questions on exam day.